Let's find out a little bit about how Jefferson City Medical Group helps individuals, either if they get a work accident, a life accident, or they're on the field of play, maybe throwing that touchdown pass and get sacked. They need help. They need to get back in the game. Let's check inside Jefferson City Medical Group.
The thing I like best is just the ability to impact people, on a direct level. I mean, function, our ability to move and be active is what equates to life.
It's really just rewarding to see that transformation from being frustrated and disappointed and hurting to being oftentimes pain-free and back to doing the things that they love.
Knowing that I make a difference in people's lives is, I guess, the reason that we go into work every day. It's ultimately what we did all the work in school for. It's all kind of comes full circle, knowing that people depend on us to make sure that they get the proper care needed and that we can do that for them.
My name is Kevin Middlemist. I'm an orthopedic surgeon. I'm an osteopathic physician, so a DO. I work at JCMG Orthopedics and Sports Medicine. So I do a wide variety of sports medicine injuries, ranging from rotator cuff injuries to ligament injuries to the knee, shoulder, hip. Specifically, I do a lot of rotator cuff surgery, ACL surgeries for athletes, and other conditions where people, ranging from high-level high school athletes all the way to your weekend warriors to, the aging population. So an average surgical day usually is between 4 and 6 cases surgery-wise. And then typically for me, as far as clinic goes, I typically see between 40 and 50 people in clinic, ranging from knees, shoulders, hips, different pathology. People have aches and pains. As far as the schooling it goes, obviously you have to go through high school, 4 years of college or some sort of collegiate degree, and then you got to go to 4 years of medical school. And then after that, you got to get accepted into a residency, which is for orthopedic surgery, it's 5 years in length. And then for me in particular, I did a subspecialty fellowship in sports medicine surgery, where I did advanced training in shoulder and knee surgery and then taking care of athletes at a high level. For me, I was fortunate enough to work with a professional baseball team in Cincinnati. That was a very cool experience that I'll get to cherish for the rest of my career. Advice as far as to specifically for my career path, I think number one, you've got to be highly motivated, because it's a long road. Be motivated, be committed, and then if it's what you want to do, set your mind to it. And if you really enjoy that aspect of it, it's a very rewarding career path.
I decided to become a nurse because, for one, my mom was a nurse and I grew up watching her take care of people. There's a lot of sacrifice involved, but she loved doing it. I watched her in action, taking care of people, and I knew immediately this is what I wanted to do, and I wouldn't be happy doing anything else. My specific duties here in orthopedics are seeing patients that need non-operative care and operative care. If they do not need operative care, there's a different level of care that they can get, medications, injections. We just make sure that the doctor's aware of what they need. And if there is surgery involved, then we assist in planning the surgery and making sure that everything is set up from beginning to end. Someone that's wanting to get into nursing, I would suggest that they, for one, do their research. You want to make sure that you're going to be going into the right field. You want to make sure that you are going into, LPNs have different responsibilities than RNs. So making sure that you're getting the right education at whichever school that you go to is really important. And you need to make sure that you have the passion for wanting to take care of people.
So I knew kind of like as I was about to go off to college that I was interested in the medical field. I didn't know exactly what I wanted to do. I was thinking, maybe PT, considered medical school. So I was kind of all over the board. And then I actually had a shoulder surgery when I was in college. And when I had the surgery, the surgeon that I went to see, he had a PA with him, and I got to interact with him and see what he did on a daily basis. And I'm like, that seems like a pretty cool job. And the more I looked into it, I figured out that was what I was really interested in doing and thought it'd be a perfect career path for me.
I think there's some key sentinel event that says, hey, I either had this experience with a doctor, that experience, and then it kind of goes, oh, I really like doing that. And for me, as far as for orthopedics, it's such a hands-on experience. I like working with my hands. I like being able to treat patients and help people.
I decided to become a medical assistant because I'm really interested in a career path as a physician assistant. And I feel like this will help me gain more experience in the medical field and getting more patient care experience so that can better my application to go to PA school.
There are a number of different ways that you can gain patient care experience in order to prepare yourself for PA school, whether that be the MA program as working as a medical assistant. We have some awesome medical assistants here who do a great job for us and are able to take great care of our patients. People are able to be patient care techs. You can be an emergency medical technician in the ER. You can be a CNA. There's really countless ways you can get some patient care experience. And then once you have some experience, you apply for PA school, get interviewed, and then attend PA school, which is a master's program most of the time. There are a few doctorate programs out there. But I got my master's for PA, and it's usually somewhere between 2 and 3 years for PA school.
It's not uncommon for, people to become an MA or a scribe and then work in a medical field or office and then ultimately go to medical school and then beyond. And so it's certainly not an unrealistic expectation just because maybe coming out of college, you didn't get into med school or chose not to. It's not something that for the rest of your life, this isn't a possibility. I know people who've gone back to medical school at a later date and ultimately they were able to get into this field and were able to pursue and have successful careers.
To be a medical assistant, you actually don't have to have a degree. There is a certification certificate that you can have, but you don't have to have that. All you have to be is 18 with a high school certificate. So my job duties as a medical assistant entail rooming patients, really getting the background as to why they're there. I do a lot of the charting, do a lot of anticipating the physician's needs, drawing up injections, stuff like that. So the sports medicine part, we see a lot of athletes come through here. So to see them pull through an injury and to be able to get back to doing what they love to do and to see the doctors be able to do what they love to do as well and to help get the patients feeling better is super rewarding.
I decided to become an X-ray tech. Honestly, I didn't want to be like a bedside nurse, but I knew I wanted to help people and work in patient care. I help do MA work too, so I'll room patients and then we'll order the X-ray that the physician is wanting, and then we'll just take them back and obviously position them and cone it down to the certain area that the physician is wanting, and we'll shield and do all that. Some days patients come in here and they have no idea what's going on, and imaging is a big part of diagnosing what's going on. And so yeah, I do think that being an X-ray tech with orthopedics makes a big difference.
So kind of my role here is I'm able to evaluate patients. I can diagnose and treat. PAs are able to prescribe medications. We can administer injections, and that's my role. Kind of half of the time, and then the other half of the time is in the operating room. And I first assist in the operating room. So kind of what that entails is assisting the surgeon in any way that can be helpful, and most of the time, PAs will be the ones who close the wounds at surgery, and so I really enjoy that. It's a great variety and a great part of my job to have that change being in clinic and also in the operating room. In order to become a PA, you need a bachelor's degree. You can get a degree in pretty much anything as long as you get the prerequisites required to go to PA school. And then generally speaking, PA schools either require or strongly prefer some form of patient care, healthcare experience. So for me, I was an EMT on the ambulance for several years before going to PA school. Orthopedics is really what I love and what works well for me. We get to see people with various musculoskeletal complaints, so it's really rewarding to be able to see that, somebody that's hurting and that's having trouble doing the things that they love to do and be able to get them back to doing what they love. Knowing that I'm able to make a difference in people's lives is really a cool thing. That's not something that you get in every profession, and I really think that it's truly an honor to be able to have the responsibility of medically treating people. It makes me feel like I'm really making an impact on people's lives.
And joining us today is Blair Mitchell, Director of Clinical Operations, and Seth Freeman, Training and Development Director for JCMG. Blair, Seth, welcome to Healthcare Career Day.
Good morning.
Well, why don't you share a little bit about what you do and an overview, and then we'll go into live Q&A with some students. We already have some students asking questions.
You want to start, Sasa?
Yeah, I'll kind of start off with just general JCMG information. So we are an independent multi-specialty clinic based in Jefferson City, Missouri, with about 30 specialties covered. Orthopedic and sports medicine is one of our premier divisions that we have definitely seen some growth, and that's why we wanted to highlight them today for everybody on the call. So a little bit about myself. I am the training development coordinator here at JCMG, so I am part of the human resources team. So as part of my daily duties, I work with orienting, doing the onboarding for brand new employees, as well as working with training and continued development for existing employees as people move into potentially leadership positions, or other higher responsibility roles. I help, with the development and support of those. So it's a little bit of everything, not just the ortho side of it. And a little bit of my background of how I got into it was, I was pre-med in college at one point, but then I realized as I got near a graduation that I didn't feel like going into $100,000+ worth of debt, when I'm there. So I, got into the working field and got into management. I had actually my BAs in history, strangely enough. But I got into management from there and then moved into the human resources and kind of development and training side of it. And that's how I transitioned in this role here at JCMG. About 2 years ago is when I came on board as this director for the training and development. So I will hand it off to Blair to talk about her experience.
Yeah, so I'm Director of Clinical Operations here at JCMG. My background educationally is in marketing and business, so didn't expect to come into healthcare and kind of fell into it and fell in love with it. So got a master's degree in healthcare administration along the way. Spent about 20 years, mostly in clinic operations, some of it in graduate medical education, which relates to what Dr. Middlemiss was talking about as far as all of the training that they have to do and kind of managing that program. I've had the privilege of working in orthopedic and sports medicine, both in a very large academic health setting, as well as now here at JCMG, and can say that it is a favorite of mine because of all of the opportunities that it allows for types of roles. And kind of that team mentality of getting it done together. Not a single one of those people that you saw in the video could do it without each other. And so it really allows us to put process together in a team environment. So excited to talk to all of you today about your questions and what we do.
So one of the questions is from Van Horn, Project Lead the Way Biomed. Kaylee is asking, I've seen a lot of athletes on TV have injuries. What is one of the worst injuries you have ever seen? Good question, Kaylee.
Oh my goodness. Well, so I'll preface this with I am not clinical. Dr. Middlemiss would probably be the best one to answer that question, but I can tell you we see all kinds of things. In the clinic, they usually aren't quite as severe, at least as they present, right? We're going to see more of those things come through the ER or things that are taken kind of straight to the OR. But those things that you see on the TV do happen. I think Aaron Rodgers, it was his Achilles that just snapped and took him out before he got to do what they anticipated him doing. You see a lot of ruptured ACLs or meniscus. And then you will see some of those open fractures that are pretty ugly, that can penetrate skin. And then you get into, other things that can be more traumatic in nature. But I would say that in addition to having lots of different roles, you can see lots of levels of injury and need for care. And then even the degenerative pieces as you get older where, our bones get more brittle. And so you will see some breaks or some total replacement needs ultimately. So I think everything you could think about, Kaylee, you probably could see in orthopedic surgery, the good, the bad, and the ugly.
Great answer there. We do have a Smith Cotton that we're going to try and go live to here in a minute. So Smith Cotton, we'll go ahead and try and get you to unmute your mic and your volume and your video, and we'll go live to you. In the meantime, we had a student that asked, does JCMG specifically allow high schoolers to job shadow? Great question.
Yes, we do job shadowing all the time at JCMG. It's really just you would want to reach out to one of the physicians and express your interest with them and saying, hey, I'm interested in this field, want to learn more about it. Could you set up a job shadow with us? So usually what you do is you come see us first in my HR department. We have you watch a couple informational videos just to teach you about HIPAA and privacy laws. And then that usually takes us about a half hour or so. And then you will be good to shadow in the department for as long as they want to. Sometimes they'll do, just a 1 or 2 day thing. Some people will do a little bit longer depending on what their schedule looks like and what the physicians, are comfortable working with them. But yeah, that's definitely something we do and encourage people to get a better idea of what the actual day-to-day job looks like.
Fantastic. Thanks, Seth. We're going to actually try and go live to Smith Cotton. So Smith Cotton, if you want to go ahead and unmute your mic and your video, and if you want to ask your question directly to Blair and Seth.
Hi. We wanted to know, what is the most memorable or challenging case you've worked?
Great question.
Okay. So hi, Smith Cotton. Many moons ago, I played softball up there. It's a great place. So I'm glad you guys are on here. So again, Dr. Middlemiss, we were trying to get him today, but he is in the OR. So some of these we may have to follow up on. So I can't speak specifically to a case that he has worked. But again, with him working with a professional baseball team, I know that he was involved in quite a few surgeries on those professional athletes. And as you guys can imagine, on any patient, they are providing high quality care, being very, very careful, all the things, no matter what you do. In those scenarios, there is a lot of investment in those patients, right? So they usually come with risk and benefit based on their professional career. And so I think Dr. Middlemiss probably would relate some of his most memorable cases to some of those athletes that he worked on and ultimately got them back on the field doing what they are being paid to do.
Great question. Great question. Smith Cotton, any other questions for him? Okay, fantastic. Well, thank you so much. I know, one thing that I think a lot of students want to know, or at least, maybe you can share about this, Blair, is if I get hurt, there's, this is me talking, my mindset is to suck it up and keep going, but that's probably not the best thing to do, is it?
Yeah, that would be true. So I think we all try to just suck it up and keep moving. But what I've found in my role, helping to support the physicians and others that work there, is that those little things that we think aren't a big deal, especially as we get older, but even young, can definitely turn into something worse, right? So, bones can fracture or even have hairline fractures that then can turn into something much more. All of our joints and ligaments, they push and pull all the time. But if we extend them enough, they're like rubber bands, and at some point they can snap. So I would say, if you or someone gets hurt and it's something that just kind of doesn't go away, have it checked out. And sometimes that can start with your primary care physician, who then could refer you on to see us if they felt like there was a greater need. Usually that'll come with some imaging, an x-ray at least. Or you could get in with an orthopedic surgeon to kind of look and diagnose that further. I think Brett Gerstner, our PA, kind of mentioned that there are a lot of operative as well as non-operative treatment plans. And some of that can come through physical therapy, even if it doesn't require medication or injection or ultimately surgery. So I would say if something's just not right, just don't let it go too long, because as you're young, taking care of your body, your bones, your joints, your ligaments only will make it better as you get older.
And I think we have one more question. Great answer there, Blair. One more question. We do have a student from Hazelwood East High School. Do orthopedic nurse practitioners perform surgery? Good question, Hazelwood.
So the answer is yes and no. So as an advanced practice provider, that's what we call our nurse practitioners or physician assistants. They often can go into surgery with the orthopedic surgeon and do what we call first assist. So be involved in the surgery, maybe positioning a hip as they're working to replace it, or if there's a tear, ensuring that the knee is positioned appropriately, assist throughout the surgery as needed by the physician. Sometimes they will suture and close after the surgery. So they can definitely be involved in critical components of the surgery, but they cannot operate alone or do the primary parts of what that orthopedic surgeon is trained for. So I would say if you enjoy surgery, you enjoy being involved in those parts of the care in addition to that care in the clinic, but you're not sure that you want to go on to kind of the surgeon role, and nurse practitioner or a PA position is a great way to be involved in those kinds of things as well.
Mm-hmm. Fantastic. You know, it really is a team, and that's what we're hearing today from you at JCMG. It's a team that puts you back on the field of play when you get injured. So, and don't delay and don't waste time like this guy right here before going into the ER, the emergency room, or the physical therapist office.